Good morning, good afternoon, or good evening, wherever you find yourself listening to this. My name is Deepu George, and I'm currently an associate professor in family medicine and a behavioral health consultant at the University of Texas, Rio Grande Valley School of Medicine. And I do have the privilege of serving as the president of CFHA. Starting this year, we wanted to experiment with providing you, our members, and our most vital resource, updates on what is happening, especially from the perspective of community, board of directors activities, and various engagements. CFHA has so many vibrant offerings. Perhaps this may motivate you to check in on some things that you have not done before. So my update for our first quarter will focus on people, processes, and activities. So let me begin by introducing our newest members of the staff, and then I'll move on to newest members of our board of directors. So the first people up are Hannah and Daniela. Hannah Morse comes to us from Phoenix, Arizona. She's strategically placed there for this year for a conference coming up in October 2023. So as soon as registrations are open, I hope you guys will go register. She comes with an experience as an admissions counselor at a medical and dental school and a variety of administrative roles. At CFHA, she is the keeper of time, schedule, updates calendars, keeps us honest through good minutes, edits recordings, coordinates things with members, and keeps the database and the wonderful listserv up to date. What gets her excited about CFHA is having her prior experience in a medical sphere. She has understood the importance of integrated behavioral health, and she's happy in her ability to support clinicians working towards this goal. Our next person is Daniela Vela Hernandez, comes to us from Imperial, California, very tiny county on the US-Mexico border. Fun fact, I too live on the US-Mexico border in McAllen, Texas. That is where the Rio Grande Valley is. Now, by trade, she's an LMFT, working with county behavioral health services. In her past, focused on seriously mental ill populations and dual diagnosis. She also served as a regional director for a startup company focused on collaborative care management programs for sales, implementation, training, clinical oversight. She loves to work from home, which gives her the vital time needed to be a glorified Uber driver, and I'm sure an Uber mom to her 10-year-old daughter and 7-year-old son. At CFHA, she will be focused on providing technical assistance to our very many clients that we support towards integrating physical and behavioral health programs. So those of you who don't know, one of the big arms of CFHA is technical assistance. So if you need projects and other things or consultations, keep us in mind. She also supports our current directors group and will continue to play many other roles in the future. She is excited about the impact she can make through IBH work and believes that whatever we do impacts our patients and providers alike. Next, we have our two newest members, our board of directors, Dr. Jen Thomas and Dr. Jenna Fisher. Jennifer Thomas is a family medicine physician and director of integrated care at Morris Hospital. Her entry to the world of CFHA started with a random find on Spotify for a podcast that she was looking for related to integrated care. And lo and behold, she stumbled upon our CFH's The Integrated Care podcast. And this is a plug to go and subscribe on Spotify or other places that you subscribe and listen. And like her, for you, it could be life-changing because through listening and being engaged, she's now on the podcast team and ultimately serves on the board of directors. We are really excited to have her on board, especially to have a physician perspective to guide our growth and future strategies. Jenna Fisher is the next person. She is a licensed psychologist, clinical psychologist, and comes from a vantage point that is very unique. She is the Senior Executive Director of Clinical Services and Innovation at Meraki. She served as the Executive Director of Innovation prior to her this role that she's fulfilling now. And she comes to us with unique experiences in the world of policy, finances, strategic leadership. We're excited to have her lead and inform us in our work as we shape the future. So now you have faces, names, and some details. When you see them virtually or at a conference, go and say hi to each one of them. We're here to serve you, and this is your community. We want you to know the different people that are connected to us. Next up is processes. Processes, one of the first things that I want to give you is an update on our diversity, equity, and inclusion processes that we've been taking on. We have been working with this organization called MDC Rural Forward, and they are walking us through a facilitated process to help us develop benchmarks for our work as an organization serving our members, which is all of you. What we have done is the group has led the board of directors through a process, and we have developed a common platform of definitions and understandings. What is going to happen next is an ad hoc process that we've introduced to get more voices and perspectives into the process. So we currently have a work group that is consisted of the Just Medicine Committee and the Research and Evaluation Committee. They're going to meet with MDC Rural Forward, and they are going to update them on what has happened so far so the work group can catch up. The work group will then sit with the document that has been created, and their goal is to really massage and finalize a set of benchmarks that they will present to the board in July. During that July meeting, it'll be a facilitated meeting with the presentation from the work group and MDC Rural Forward. And if everything goes according to time, we should be able to present a lot of our work that was completed for DEI for CFHA in the upcoming conference. Now, this does not mean we're not doing DEI related things at the moment. One of the things that we can tell you about that is happening in the background is this whole process to include care enhancers as part of our membership. They're often folks like medical assistants, community health workers, and other people who really work to make our patient care better and our lives better. They're often also lower on the totem pole as in an organizational structure and are likely to be on the lower salary scale for the members of a healthcare team. So our governance committee, in partnership with Jackie and other staff at CFHA, is working through a strategy to include them and what would it mean to give them membership, and how do we make processes equitable so they can even access bigger things like conferences and other things that we offer. Speaking of committees, you heard me mention governance committee. Governance committee is a committee within the board of directors that really delves into processes, policies, and procedures. Their goal is to help us become consistent in what we do. And so they work on a series of tasks every year. Our partnerships and policy committee is really scanning the environment and understanding the current state of healthcare policy and potential organizations and folks that are doing important work and how we can align with them. And they will both be presenting their updates in the upcoming board meeting. The other thing to keep in mind, which is something that we're thinking about, is next year is our 30th birthday, which is 30 years of CFHA. And we're thinking about how to honor 3 decades of this young and vibrant movement that we call integrated care, and that is the heart and soul of CFHA. So those are all the things that are happening in terms of processes. Next up are activities. Now, for activities, I really want to point you towards a couple of websites, because that's where you can kind of find up-to-date information along with details of how you can be part of that. The first up is if you go to cfha.net/events, you will really begin to see the number of offerings that are available. For example, on March 29th, there is Serving Latinx Populations webinar. On April the 3rd, there's the Pediatric Special Interest Group meetings and community conversation. On 5th of April, there's the Directors Group meeting. There is a PCBH SIG meeting, a Special Interest Group meeting on the 5th as well. Wednesday the 5th is also a very busy day, because on the same day, there's a Collaborative Care Management or COCM work group meeting that day as well. I am just giving you a sample of what's available. As members, please log on and make sure you're making use of these wonderful opportunities to improve your practice, your career, things that you are passionate about in integrated care. The other landing spot that I want to put all of your attention to, and you may want to save this, is integratedcarenews.com. Hopefully you'll favorite this, or however you say it, right? Hopefully you like it or store it or put it in your bookmarks so that it becomes one of the sites that you repeatedly come back to. There you can find latest videos, news, really informative blog posts, and the latest podcast and the link to that. So if you can listen to it and be part of the community. So people, processes, and a whole set of activities. We will come back to you next quarter with additional updates on things that are happening. You may be hearing from me or one of our colleagues at the board of directors. Our goal is to stay in touch with you. If you have news and events that are exciting, that have been life-changing, and we are happy to update the community on that through this forum. In terms of people, one of the things I want to start recognizing are folks that are doing wonderful things in the community and nationwide. And so if you have specific folks that have done important initiatives or are part of important initiatives, please let us know. And I'll be happy to put them up on the update and let our community know how we're engaged nationally and locally. So hopefully you guys have a good rest of the day, week, month. Thank you for giving us a little bit of your time, and I will touch base with you very soon. Thank you so much.